All right. My name is Acacia Barnett. I am the program manager of Blackstone LaunchPad, and I just want to thank you all for being here. We have Chloe Watts, who is with STChealth, and we're so excited to have her with us today to just get a little bit more insight on what a senior HL7 does for analysts. So let's just jump into it. Chloe, can you share your journey and how you got started in healthcare technology?
Yeah, my journey is I I originally thought my journey was an atypical one, but I would say nowadays in the tech industry, it's more of a typical journey. But it was more about who I knew and less of what I knew or where I went to school. I had moved to Cheyenne, Wyoming, and I knew I wanted to get into the state, for that retirement, those benefits. You guys know how it goes. And when you're trying to break into state positions, because a lot of elderly are sitting in those positions, they've held them for a really long time. You have to be very strategic. And I wound up falling into an onboarding and interop position at the immunization unit for the state of Wyoming, which got me into what I do now and who I work for now. But it was a lot more about getting my foot in the door and getting that experience. More than what I did, prior to that.
Awesome. And can you tell us what kind of education and training that you pursued for the role that you have now, or if there's any specific like certifications that one has to do to be in health technology?
Yeah, so it was a requirement to have a degree. It wasn't necessarily as important in what it was in, just that there was some gen ed or formal education there. And so I have a bachelor's of arts in psychology. So just as long as I had a BA, that was the first step to acquiring the educational piece. And then from there, they actually paid and trained me for my HL7 certificate. And then right now I'm actually working on my project management, my CAPM, the first step to the PMP. And those are all done through the company. They pay for all those, but the HL7 certificate was a hard stop requirement to my promotion in being a senior on the team.
Awesome. For all of us who are unaware, can you explain to us what HL7 is?
Yeah, it
So,
stands
like
for
briefly.
Yeah,
Look at the
no,
word
that's
for
such a good point. It stands for health level 7, and it's actually a coding, like think of it like a language, right? So basically when you work at a doctor's office and you're entering into your EMR system, that EMR has to speak a language to certain registries. And the one that we build and make, like what the tech industry that I work in is immunizations. So here in Arizona, it's called ACIS, the Arizona State Immunization Information System. We own that. And HL7 is the kind of language that it speaks. Sometimes it's JSON, but typically HL7. And so you have to be able to read that coding in that type of message on the back end.
Thank you. Thank you for that explanation. It's very helpful. It's very interesting. So what were some of the biggest challenges that you faced in your career, and how did you overcome them in this HL7 senior position?
Oh, that's a great one. Honestly, for me on a personal level, teamwork was actually the biggest challenge. I'm someone that thrives individually. I'm someone that if you give them a task, they will complete it, they will present it, they will own it. It is mine. The kudos are for me. And so when taking over this senior position and taking over a team of 7 other people, we are in charge of 14 registries across America right now in 4 other countries. And wasn't used to sharing projects, wasn't used to sharing my kudos, wasn't used to share like doing the work, but guiding a team. My team is all brand new. As far as this position goes, they're all under a year at this point. Well, I think Carlos just hit a year and a half actually. But they're all new. They all came from different walks of life. One worked for a provider in Arizona, so they had the EMR aspect, and that was really important to us. So we brought them on. But definitely the teamwork. I realized that I can win a lot of small battles, but I will lose the war if I don't learn how to operate from a team functionality, be able to delegate and be able to trust other people's work, even if it doesn't look exactly like mine. I had to learn that kind of the hard way in this position. Teamwork. That was the hard one.
Thank you. Love that for you that you're learning to work in a team. One other random question. What is ESMR for?
Oh, an EMR. So it's
Yeah,
an
what's EMR?
electronic, yeah, it's an electronic medical record. I think a lot of people still call them EHRs, an electronic health record system. It's like Epic or Athena. It's the software that your healthcare providers use to enter all of your health, your HIPAA, your
Your
health
records.
information. Yeah.
Oh, cool. Thank you. All right. Now, can you describe a day in the life of a senior HL7 analyst and what are your key responsibilities? We know that you're in charge of some people, but what are some of those responsibilities that you have?
So delegation to state contracts is really important. Again, we do have 14 states and 4 countries. Right now, I think that's the count. And so the first thing is meeting with people. It's a lot of meetings, I think, across the board in the tech industry. It's a lot of meetings, and then you got to find out, in your 30 minutes where you're going to do the work that you discussed in the meeting. But it's a lot of meetings. We do weekly interrupt meetings with all of our states. So like today we did Georgia, and Mississippi and Virginia. We actually just won the Virginia contract. So we're transitioning them from one vendor to ours. And so today, like if I just went over today was talking to Georgia about their transition, talking to Virginia about their transition, talking to 2 vendors, Athena Health and Veradigm, also formerly known as Allscripts. They are major players. Those are those EHRs that you see in all these transitions. They are responsible for getting the provider data where it has to go, changing endpoints, passwords, credentials, things like that. So my job is a lot of just meetings and pointing and taking notes and making sure I get it in front of the team in a timely manner, and then getting the team onto the tasks at hand. That's pretty much what this position does at this point.
Awesome. And I only know this because I know Chloe, but these contracts, they last like years, right? They're not just a month project or whatever. Like these are really long meetings that last for years.
Yeah, these are typically anywhere between 2 to 10 year contracts for the states. And I mean, you just have to think of it from a state perspective. They don't have a ton of funding, and they also don't want to switch because then you have to take all of your orgs, facilities, end users, and immunization records, serology testing, lead-based testing. Those are all things that live in your IAS, ironically. And you have to move them to another platform. So it is a lot easier to stick with one vendor than to switch around a lot more. So you don't see switching. So the fact that we do have 2 transitions on deck right now is actually unheard of in the industry to have that many people switching around. But to be honest, we're seeing that due to COVID. A lot of states realized that the products that they had were behind the times. They need to innovate as the states go on. They weren't able to capture the data and be able to get information on the streets, So I'm sure a lot of you guys saw commercials in Arizona saying we have X amount of people with COVID or X amount of doses going out. And you probably thought that seems like a lot, or it seems like a little. It doesn't seem right. And it wasn't. And it was because those systems just were not innovative enough to capture that kind of data. And so we see a lot of states transitioning and moving around right now in this industry.
That's so cool.
Yeah.
Okay. What do you think is the most important technical and soft skills for succeeding in the kind of role that you have? You talked about leader in charge of quite a bit of people, but are there some other skills that you think students should acquire to do what you do?
Yeah, especially in a tech industry, it is very easy to become black and white, right is wrong, this is that. But you need to remember to have empathy when going into tech projects. It's too easy to remain analytical and to watch a project from beginning to end with no empathy or emotion to it. but having to remember that these are human beings on the other side of your project, your clients, your stakeholders, they are humans, they are overwhelmed. They are, especially in the niche industry that I work in, they are still struggling. The states are through COVID and working with the CDC and working with ERA on getting, correcting the mistakes that they made. And that can have feelings that I never considered pre-COVID. In the post-COVID, now realizing that they're embarrassed of the processes that they had, onboarding processes, post-production data quality monitoring processes were lacking. They're embarrassed. It can be really hard to have someone come in very analytically and say, you've done this wrong, let's do this now. So I have learned empathy, I feel like in the past 4 years, just remembering that these people are smart. They've done this for a very long time. They didn't know any better. They didn't have better resources or tools provided to them at the state level. And operating on that kindness and that grace was a soft skill and a tool that I didn't have originally. And that I think is very important when you work in the tech industry. You can't just be black and white with everything.
That's a really great answer. That's not a typical answer. I like it. Could you share, like, we know you just said that you acquired uh, Georgia and another state. Like, is that to you one of your biggest achievements in this role, or is there another significant project that like you're really proud of for the impact that you've had?
I would say those are huge achievements for the company as a whole. Winning an RFP from a state is a huge deal, especially prior. I'd mentioned it doesn't happen too often, right? Just imagine it being like a doctor's office and they announce that they're switching from Epic to Athena as their software vendor. Like that's huge and it requires a lot of time and a lot of training and a lot of resources that state government doesn't really have. So those are huge achievements, I would say, for the company. But for me personally, Indiana, the state of Indiana was my first client when I started here 3.5 years ago. And basically switching their entire interop process. They were very much stuck on having a wait list, kind of like Section 8. Like they just had hundreds and hundreds of providers on a wait list due to the COVID pandemic, who those hundreds of providers are not able to report to the state registry if they're sitting there. And so the first thing my team and I did is we went in, we got rid of the wait list. We got everyone onboarded within about, I want to say 6 months to a year of that. We were able to get them on a target list. We were able to start post-production monitoring, which means now you're not only focused on onboarding people into your system, but now you can actually physically watch the data that is coming in and start having harder requirements. Because what we've noticed, especially in states like Indiana, where there's a lot of rural health, and even here in Arizona, where you have reservations, we noticed that what we think is a complete patient record may not be what a provider's office thinks. Like there should be hard sets, first legal first and last name, middle initial, address, phone number, what vaccine was given or denied. Whereas people are like, instead of Daniel, we put Dan as the name. Instead of Christopher, we put Chris. That we've noticed a lot of nicknames or aliases being used with um, no charting behind that. And then your new record never makes it to your old record, your childhood record, which had your legal name and your birth certificate. Oh, you're from Indiana? That feels right. Yeah, I will say Indiana, if I had to be honest with you guys, had one of the hardest transitions post-COVID. They had, they got fined a lot federally for some of the things that we saw there, and it just wasn't their fault. That state gosh, it was just hit so hard. And of course, during COVID, I don't know if you guys noticed this. I feel like a lot of people didn't notice that pharmacists were not legally able to give vaccines until COVID hit. And then we realized people can't get to their provider's office. So we wound up just pushing pharmacists being able to give vaccines during COVID. And I feel like no one talked about it, which means all trainings, access isn't at all 50 states. We have to show them how to chart immunization records, which is completely different than a pharmaceutical record or insurance claims. And that cost every state so much time, energy, and money. That empathy, again, you've got to work with empathy when it comes to stuff like that.
This is also very interesting. Uh,
Yeah.
um, Can you share a story about a mentor that has helped you or influenced you in this health technology career path that you've chosen?
Yeah, for sure. I would say Jennifer Junkins is probably one of my favorite people that I've met on this journey. She and I met in Wyoming at the state of Wyoming. She was the interop analyst for the state of Wyoming, and I was the onboarding specialist at the time. So we worked hand in hand. She actually took a job at STC a month before I did, and she was the one that reached out and said, "Hey, I've got a spot on my team. Like, come work with me. I trust you. I trust your work ethic. Like, let's do this." And to make that connection, I know we had some people join. STC is the vendor or the software owner for the state of Wyoming, the state of Arizona. We own all those registries, and so I already had product knowledge. I knew how to onboard into the system. I knew what it looked like. So to be fair, there wasn't a ton of education or requirements around that since I already knew the product. I could demo it in my interview. And so as giggles, I did the interview, going from a state employee making 19 an hour to going to a huge tech position where you're going to make a lot more money and you can work from home in that time. Um, it was, I just did it for fun. I didn't think I was going to get it. And during the interview, I just remember Saad saying, "Okay, so like when can you start? And are you going to move to Arizona?" Which I did. I do work from home, but I do live in Arizona. It's kind of a weird situation. But they gave it to me on the spot all because I had product knowledge. That was one of the biggest takeaways and something I wanted to really mention here is if you can network and you meet people and you gain invaluable knowledge of the product that they work in or sell, like that's going to go beyond education half the time because they can teach you anything else you need to learn about that company and the hierarchy and the structures and things like that. But if you know their product, if you know what they're doing, if you can sell that to them in an interview, gold. That's gold. And that's exactly how I broke through from the state to the tech industry.
Awesome. You answered my next question. I thought you moved back to Arizona so I could do your eyebrows, but I guess I was
I mean, that was half of
wrong.
it. I was tired of traveling in every 6 months.
Just kidding. So looking ahead, what are your future goals? Do you want to stay in health technology? Like, where do you see yourself? Do you want to challenge yourself in growing in this field? What's next?
Ooh, I want to be careful with that one. So like on a small scale, what's next is Michigan. Rumor is we're gonna wind up getting that contract. And so to have Virginia on the line, to be getting Michigan, we know we lost Hawaii this year, so that was sad. But for me personally, I don't know. I would kind of like to see myself move into a director position, which I'm only a little ways away from. So kind of move into a director position within the company. And I don't know if it's in the cards. I ultimately want to go wider with my scope when it comes to immunization reporting and the importance behind vaccines and the education with it, and possibly working for the World Health Organization. I feel like they are lacking when it comes to being open about immunizations and that conversation. They do so much around other things. I just feel like there's not a lot going on with immunization. So I don't know. It'd be nice to move a little higher, maybe. Maybe.
I see it in your future. Does
Right?
STC Health have like programs to help you do those vertical jumps so that you can get into higher leadership positions?
They do. They do. So they do pay for some education. I personally have only used that for certifications, but I do know that they pay for educations to help people kind of level up in the career within STC. And then, of course, STC is not shy about helping people level out if that's also where they're going. We don't have in most of the company, we don't have I want to kind of brag and say we don't have like a ton of turnover in a lot of the company. Like on my team, it is a brand new team and they've all sat there. Two of the members on the team have been in the company for 11 years, just on this team for less than 1 year and under me and learning interoperability. They were actually a part of our call center. Prior to that, working with, boots on the ground provider support in every state. STC also runs the call center for a lot of the states.
Mm.
Um, so a lot of my team came from there. And then of course, Carlos came from Village Medical. I don't I think that's what it's called, Village Medical here in Arizona. He ran a team in Phoenix. Um, it's interesting, diverse. We don't have a ton of turnover. We don't hire a lot either, though. We do try to work with less resources. So we're actually one of the only people in the tech industry, especially with our two competitors, Gainwell and Envision. We don't ramp up for
Hmm.
projects because then that means you have to have a heavy ramp down, which you see in Google, you see in Salesforce, you see all of them right now actually having major ramp downs in their people. We don't do huge ramp ups or ramp downs, which is really nice. Yeah.
Do you find that they will help people who work at STC get like master degrees are wanted or doctorate degrees are wanted, or is it just really those certifications?
I think like if I was going to be honest, if I had to go back and read the contract, it's they will help cover educational costs that specifically hit your job description, which I think is where you get in the weeds arguing with HR about what does and does not fit in your job description. I had to kind of argue for my CAPM because I do manage interoperability projects, but I am not a project manager. We actually have a very separate project management team. So I had to kind of fight for that one. I do not think that they would help fund an entire degree for anybody, but I do think that they would help hit certain classes. So I do think if you're gonna hit something outside of our tier one, which is our call center, if you're actually gonna go for one of the bigger departments, you do need to have a degree. But I mean, one guy that I work with has a cartography degree. We don't make maps. But he is amazing on our dev team. He is just a ray of sunshine and he's really fun to work with. And he thought that that would just be a fun degree to have. So
Nice. Well,
not not weird or unheard of to have random degrees and come into this industry.
okay, well, that's good to know. Um, the doors are wide open. Do you guys do, my last question, do you do internships at all at your STC Health?
I would have said no. If you would have asked me 4 months ago, I would have said no, but I actually checked my email. First, long time listener, first time checker, apparently. And I saw that we were saying goodbye to an intern who's it's the CFO's grandson or something. But I thought he just worked for us, but turns out he was just an intern who's now going away to college at ASU. Yeah, so I didn't think we did, and I asked about it, and I said, "Did we just do that for him?" And they said, "No, we have an intern program. Like we do have those." And I was like,
Oh, great. Good
"Oh,
to know.
right, never met them, but they're there apparently."
Awesome. Well, thank you so much, Chloe, for answering all these questions. I'll stop talking right now. If there's anybody in the chat that has any questions, you're more than welcome to ask them or put them in the chat. This is a lot of great information about health technology that I'm sure none of us knew was so important. But I think it's really great that you guys are expanding and helping these states.
I know. We're also, just so everyone knows, STC Health is headquartered in Phoenix, Arizona. So they do a lot of partnerships with people in Phoenix, Arizona. So if you are interested, it is literally located right beside Chase Field. If you're ever walking down there and you see Scientific Technologies Corporation on the sign, stop in, talk to Paulina. She works the front desk. We do hire again, and talking about foot in the door. Tara and Walter started in tier one, answering phone calls and just getting product knowledge from the beginning. Enrique did too. Enrique moved up within 3 years, and Tara and Walter, they were SMEs for tier one, so they moved up a lot slower because they were trainers. But that is a great foot in the door. If you feel like, oh well, I've got education, but I don't have experience, the foot in the doors matter. There's also McKesson here that is located in Scottsdale. That's one of our big clients. They also work in healthcare informatics, and they are a major reporter to information registry systems. And they also have like work from home, internships, fun things like that.
That's awesome. All
Yeah.
these words, I didn't know they existed. All these companies regarding health, but it's definitely needed.
Yeah.
But awesome. Thank you so much, Chloe, and thank you everybody for joining us. This series will be on our YouTube, and we have more coming up within the month. So thank you so much, everyone, for coming and joining.
Thank you.
Thank you.